Good night. Yours truly, Professor Dolphy Gilpin, here with the introduction to the biology of the heart, the anatomy of the heart, and the physiology of the heart. Yes, truly, here at the Keto Georgia in the lecture theater, and here we have the heart projected in 5 orientation here. 1, 2, 3, 4, 5, and this is the most simplest. We're looking at the heart from an external perspective here. Here we're looking at it from a cross-sectional perspective. Here we are looking at it from a sort of a cut, and then we show the movement of the blood through the veins and the artery. And here is a sort of a coded, detailed labeling of the heart, these last two. So this is an introduction. The full-fledged lecture will take about 50 minutes to 60 minutes. And here, once again, I must say that previously, these charts were purchased at the Barnes & Noble bookstore or medical supplies at Columbia Presbyterian Medical Hospital. But apparently, I couldn't get hold of any here in Georgia. I called up a lot of places and couldn't get any charts. So I was to hand produce these and label them myself. Well, this was helpful in that it helped me to review the subject matter. You know, while I was drawing and labeling, I was heuristically doing reviews simultaneously. So that was the advantage of doing these charts myself instead of buying them. So this is 5 different diagrams of the heart here with the anatomy, physiology, and for the high school person you could do biology, and for the college person as well you could do some biology. I won't go through the detail here. I will left this up to the students for all the labelings, the aorta, the left auricle, the left ventricle, the descending aorta, inferior vena cava, the right auricle, and the superior vena cava. Here, a little bit more detail. We have the mitral valves and the tricuspid valve and the right ventricle, and those were mentioned over there already. It's just the valves, this plus the valves here. And here we have also some valves, the tricuspid valve, the left ventricle, bicuspid valve, left atrium, the semilunar valve, vein from the lungs, artery to the body, artery to the lungs, veins from the body, right atrium, tricuspid valve, and right ventricle. And these are the 2 detailed labeled diagrams of the hearts. So this is up to the student, the biology student, the student of anatomy, and physiology is when you do and study the function of the heart, you know, and tell exactly what the heart is doing with the blood when it goes through the valves and the mitral valve and the left ventricle, and when it goes away with deoxygenated blood and comes in with oxygenated blood, so on and so forth. This is left up to the student in the physiology of the heart. And my scopes is dropping away here. This is not really for a show. These scopes represent something as it, you know, from the journey from New York to Brooklyn, through to Columbia Presbyterian, through to New Jersey. I had one of these scopes which was purchased at Columbia Presbyterian Medical Supplies at 168th Street, Avon Place. This one was purchased in UCLA, and this one was purchased in UCLA down there in California, where you did different medical reviews and studies. So this is the purpose of me wearing this thing, and I've been doing a continuous intermittent research here since going on 8 years since Maryland, Baltimore, Maryland, at the Baltimore waterfront, where I also purchased this lab coat. I was also doing it prior to that, but then it's when I take it up seriously when I bought the lab coat. That's when it became serious work, medical work, though it was intermittent and not full-fledged as it was 1995, 1990 to 1996. That was full-time concentrated medical research. Now it's intermittent. I have also engineering, and I have also work to be done so I could put some muscle to my mouth and pay my rent and so on and so forth.